Hello, my name is Kasey White and I'm a distance student at the University of Kentucky. This is my blood bank presentation. I'll try to scoot it here to where you can see. And I chose week D as my topic. The reason I chose week D was because whenever we were in MLT school and lab, we would type ourselves, and I found out that I was week D positive. And then whenever Dr. Schwartz discussed that in this class, it just re-sparked that interest for me. So I hope you guys enjoy this as much as I have enjoyed researching it. A quick overview of week D is that the D antigen on the red cells is still normal, but of course is much more decreased than in a regular D positive patient. So at immediate spin, you'll have absolutely no reaction in tube, and then at the AHG phase, we'll see agglutination. And then this, of course, is captured in gel, which is what we use at the place where I work. And then this is just an example of that. This is the tube, and then this is what it would look like in gel. And a little bit of history on week D is Stratton discovered week D in 1946. He reported it as a new Rh allelomorph and called it DU. And so that's where we got the term DU from. But then in 1992, Orthodiagnostics held a meeting, and testing had become a lot more sensitive. So it was found that there are more than one weak D type. So that is whenever they recommended the use of the term weak D, just to include all of those types in general. And then fast forward to 2015 is when the AABB and CAP recommended that blood bank labs you should use serologic weak D testing with AHG to determine if a patient is weak D positive. Okay, and so it's really important, of course, to understand weak D versus partial D. Weak D is normal D on the cells, just less of it. Partial D is an actual mutation on chromosome 1 that causes not a full D antigen to be formed. And so that's where Dr. Schwartz had also mentioned in lecture that a patient, which I find this is really interesting, a patient that is Rh positive can form an anti-D if they just have a partial D antigen. So it's weak D versus partial D. And then why is weak D testing important? Weak D testing is important in the lab mainly to prevent hemolytic disease of the newborn by determining whether or not a mother needs RhoGAM. So Rh negative mothers will be typed for weak D, and also Rh negative infants will be typed for weak D. And because if the mom is truly Rh negative, then she would not need RhoGAM throughout her pregnancy. But then also, if her baby were truly Rh negative, then she would not need a RhoGAM injection after delivery. However, if the baby were to type as weak D positive, this could cause some issues, so the mom would still need to have that additional RhoGAM injection after delivery. And here is a case of an instance where hemolytic disease of the newborn was caused specifically by antibodies to a weak D antigen. So this baby was born to an A negative mother. The baby typed as A negative, so there was no ABO discrepancy. But the direct Coombs was positive. And then the bilirubin levels kept rising, and everything looked like hemolytic disease of the newborn. G6PD was analyzed and was at normal levels. So this baby was treated with an exchange transfusion. And I'm sorry, I may have forgot to mention the baby was weak D positive. So the baby was treated with an exchange transfusion and 72 hours of phototherapy. And after that, bilirubin levels started to decline. But the instance of this happening is very, very rare. So only about 1% of Caucasian population is weak D positive. So the instance of having an Rh negative mother give birth to a baby that is weak D positive is also very rare. But this is an instance that's really interesting because there was no ABO incompatibility, and it was determined that this was entirely caused by a weak D antigen. and it was pretty severe. So this, while I was researching the molecular methods for weak D testing, it made me wonder, should we utilize weak D testing in the blood bank lab? And the main reason that we would want to know is, what could it do to help our patient experience? It could reduce the amount of RhoGAM that's given, and then it could also increase the availability of actual Rh negative blood. So both of those things would be beneficial, not only to patients, but to healthcare facilities as well. So actually weak D is classified as 3 different types whenever it comes to the genotyping. Weak D 1, 2, and 3. There are actually 16 types of weak D, but these 3 types is what's used in this algorithm here for determining if a patient is truly Rh negative, or if they need RhoGAM injections. So if the weak D type 1, 2, and 3 is not detected, then the mother would still need RhoGAM and would still receive negative blood. If the weak D 1, 2, and 3 is present, then you would not need the RhoGAM and would be Rh positive if it came to transfusion. So in conclusion, I'm really excited to maybe see molecular methods be used in the lab, because some of the articles I read had mentioned that it was with the technology that we have today, and that we use molecular methods for quite a bit of other things. Why not use this to increase patient care as well? And that's what these articles recommended, was that we phase back in this weak D genotyping in the clinical lab setting. That way we can we already try to give the patients the best care and experience that they can receive, and with what we do now with serologic weak D testing. But we can further that, I think, by implementing weak D genotyping procedures for serologic weak D patients. And then not only would this increase the patient care and hopefully patient experience and outcome, but then also it would reduce costs for healthcare facilities if you're not administering as much RhoGAM, or if you have more blood that's available that is Rh negative. That would make a big difference in patient care, especially in rural Appalachia, where a lot of small facilities they're only allowed to have so many negative units because of the blood shortage. So a way to increase availability of Rh negative blood is always very important. But I've really enjoyed this research topic, and I really hope that you guys have enjoyed this presentation. Thank you for watching.